Hey everyone, and welcome back for another deep dive. This time we're really diving headfirst into Lord Darzi's independent investigation of the NHS.
Yeah,
It's a big one,
it is a hefty one. Yeah,
packed with data and analysis.
absolutely.
And honestly, some of it's pretty concerning.
Yeah.
But don't worry, we're here to break it down, highlight the really impactful findings, and really get to the heart of what is going on with the NHS right now.
I think it's about going beyond those headlines, isn't it? Those sort of attention-grabbing headlines and actually understanding what are the real underlying trends that are affecting the nation's health and then by extension, the NHS itself.
Right, because it's not just about waiting times and backlogs.
No.
This report paints a picture of the state of the nation's health overall, and it's not great. I mean, one of the things that jumped out at me was the fact that life expectancy isn't improving at the same rate it used to,
Yeah.
and more people are living with multiple long-term conditions.
It's a critical issue, and it's something that the report doesn't shy away from at all.
Yeah.
We are living longer, but we're not necessarily living healthier.
Right.
And this obviously has a direct impact on the NHS. More demand for services, more complex cases, just this constant strain on resources.
Right.
It's a bit of a vicious cycle, really.
Totally. And then it's even worse when you start to look at the link between poverty and health.
Yeah.
This report found a direct correlation between areas with high child obesity rates and then an increased strain on A&E services.
Right.
For instance, in the poorest communities,
Yeah.
almost 1 in 3 children are obese by year 6.
Yeah. It's a really heartbreaking statistic, isn't it?
It is heartbreaking.
Really is.
And it really underscores that need for preventative care
Yes.
and early intervention programs.
Absolutely. I think addressing what we call the social determinants of health is absolutely crucial. It's not just about treating illnesses, it's about creating a society where everyone has the opportunity to be healthy.
Right.
And, factors like poverty, like housing, education, even access to healthy food, all these things play a role
Yeah.
in determining our health.
Okay, so we've talked about the overall health picture,
hmm
but let's get into the nitty-gritty
Okay.
of accessing care,
Yeah,
because we all know that's a major concern for people.
sure.
A&E wait times, GP shortages,
Yeah,
it's all over the news.
it's constantly in the headlines, yeah.
But this report really brings it home.
It does. And I think one of the statistics that really stood out to me is that in some areas, people are waiting over a day to be seen in A&E,
Oh, wow.
which is just shocking, isn't it?
Yeah.
The Royal College of Emergency Medicine actually estimates that these delays could be contributing to thousands of preventable deaths every year.
That's just terrifying.
It is a really sobering thought.
And it's not just A&E.
No, not at all.
Trying to find a GP who's taking new patients, especially in more deprived areas,
Yeah.
can feel impossible.
Yeah, it can feel like an impossible task.
I've even heard of people resorting to online consultations just to get basic medical advice.
It really speaks to that larger issue of healthcare inequality, doesn't it?
Mm-hmm.
Where access to quality care is often determined by factors like you say, postcode and income. And this report makes it very clear that this disparity in access needs to be addressed urgently.
And a big part of that, it seems, is how resources are allocated within the NHS.
Yeah.
I mean, the report found that while there's been a push for more proactive community-based care,
Yeah,
the funding doesn't seem to reflect that.
you're absolutely right. It's a bit like trying to build a house from the roof down, isn't it?
Yeah.
We've got to get those foundations right.
Yeah.
And the report highlights that a significant, chunk of funding is still directed towards hospitals,
Right.
even though, investing in things like community care, GP services, mental health support
Right.
could potentially alleviate some of that pressure on hospitals in the long run.
It's like they're stuck in a reactive cycle instead of focusing on prevention and early intervention.
It is, yeah.
And speaking of being stuck, I was shocked to learn about the massive capital investment shortfall that the NHS is facing.
It's a staggering figure, isn't it? We're talking 37 billion pounds.
It's unbelievable.
It's billions that could have gone towards modernizing buildings, upgrading equipment, investing in technology.
It's mind-boggling.
It is.
The report actually found that 40% of NHS buildings are in need of major repairs.
Yeah.
And 20% of medical equipment is outdated.
I mean, it's no wonder that people are saying that it feels like the NHS is stuck in the Stone Age.
Yeah.
It's a critical issue and one that needs urgent attention because without adequate investment in infrastructure and technology, the NHS is always going to struggle to provide efficient and effective care.
Yeah.
I mean, it's a bit like asking a chef to prepare a gourmet meal with blunt knives and a faulty oven. It's just
It's not going to be pretty.
not going to be pretty, and it's not going to end well.
Exactly. And it's not just about keeping up with the times, is it?
No.
The report specifically mentions that this lack of investment has a direct impact on the quality of care that patients receive.
Absolutely. I mean, outdated equipment, crumbling facilities, inadequate technology, these all contribute to inefficiencies,
Yeah.
delays,
Right.
and potentially, poor patient outcomes.
Yeah.
It's a complex issue with far-reaching consequences.
And speaking of far-reaching consequences, let's talk about the elephant in the room.
Okay.
The pandemic.
Right.
It wasn't just a blip, was it?
No.
The report really highlights the profound and lasting impact it's had on the NHS.
It really does. And I think one of the things that really struck me when I was reading this report was the fact that the NHS was hit harder and took longer to bounce back compared to other healthcare systems.
Why is that?
I think that's the million-dollar question, isn't it? And I think, the report suggests that it's partly due to pre-existing vulnerabilities within the NHS.
Like what?
Things like underfunding, staff shortages,
Yeah.
a lack of surge capacity.
Right.
So you've already got this system that is under a huge amount of pressure, and then the pandemic hits.
Yeah.
And it just exposes and exacerbates all those weaknesses that were already there.
And then there were the decisions made during the pandemic itself. This report kind of hints at some questionable choices that might have further complicated things.
It's a very sensitive topic.
Yeah.
But I think the report does raise concerns about certain aspects of the pandemic response and how those decisions might have impacted the NHS's ability to cope.
And are they saying what we should have done differently?
Well, I think it's more about emphasizing the need for transparency and accountability moving forward, really learning from those difficult decisions that were made.
Okay, so looking back and learning from it.
Exactly.
So we can do better next time.
Exactly.
Let's end on a little bit more of a positive note, because this report does highlight some areas where the NHS is actually innovating and adapting.
Yeah.
Have you heard about these virtual wards?
I have, yes. And they're really interesting, aren't they?
They sound interesting.
Because they're gaining traction as a way to provide that hospital-level care at home, but using technology to monitor patients remotely.
So they don't even have to come into the hospital.
Yeah, and it's a fantastic example of how innovation can improve efficiency and patient experience simultaneously.
That's amazing. So basically you're getting hospital-level care, but in the comfort of your own home.
Exactly.
That's incredible, especially for people who might have difficulty actually getting to a hospital.
Absolutely.
Or maybe they've got mobility issues or something.
All sorts of reasons why this could be really beneficial.
That's amazing. There's a lot to unpack there, but we're running a bit short on time for this part of our deep dive.
Okay. It is, and it's not just about the convenience factor either. It's actually about freeing up vital bed space in hospitals.
Okay.
And potentially reducing the spread of infections as well.
That's a good point.
So it's kind of a win-win.
Yeah. It's a relief to hear amidst all these challenges. So,
Yeah.
are there any other glimmers of hope in this report?
Well, I think one thing that the report really does highlight is the potential of technology to really transform the NHS.
Okay.
And I'm not just talking about virtual wards here.
Right.
I'm talking about AI-assisted diagnostics, personalized medicine based on your own genetic makeup.
Wow.
Even just streamlining all those administrative tasks that bog the system down.
Right.
The possibilities are really quite exciting.
Okay. Now, that is something to be hopeful about.
Yeah.
But let's be realistic for a second.
Okay.
Those advancements all sound great in theory.
Yeah.
But what about in practice?
Yeah.
I mean, how do we actually make sure they benefit everyone and not just a select few?
That is the crucial point, isn't it?
Yeah.
Equity of access is absolutely paramount.
Right.
We can't have a two-tier healthcare system where only certain groups of people benefit from these advancements. The report's very clear on that digital inclusion and equitable access to technology has to be a top priority.
That makes sense.
Yeah.
Because it's like with any new technology,
Exactly.
it needs to.
It's got to be for everyone.
Yeah. It's got to bridge the gap, not widen it.
Absolutely. Exactly.
Couldn't have put it better myself.
But even with all the fancy tech in the world,
Yeah.
we can't escape the fact that the NHS is grappling with a pretty serious funding problem.
Yeah, I mean, the report doesn't sugarcoat this issue at all, and actually it points to long-term underfunding, particularly during those austerity years.
As a major contributing factor to the predicament that the NHS finds itself in today.
And we're really seeing the consequences of that now, aren't we?
We are, absolutely. It's like trying to run a marathon with worn-out shoes, you know?
Right?
You might make it to the finish line, but it's going to be painful.
It's not going to be pretty.
And probably a lot slower than you hoped for.
And probably a lot more damage in the long run.
Exactly. And the report actually puts some hard numbers on it.
Okay.
Did you know that the NHS is facing a staggering 11.6 billion backlog of maintenance?
You're kidding.
That's money that could have been invested in improving facilities, upgrading equipment, creating a more modern and efficient healthcare system.
It's heartbreaking when you actually think about it.
It is. It really is.
And it's not even just about aesthetics or anything like that. It's about patient dignity,
Dignity.
staff morale,
Absolutely.
creating an environment where people feel valued and cared for.
Absolutely. Because you're right. It's not just about the bricks and mortar, is it?
It's not, no.
And the report really echoes that sentiment.
Okay.
You know, it argues that investing in the NHS isn't just a matter of social responsibility.
Right.
It's about investing in the nation's economic well-being as well.
Because a healthy population is a productive population.
Exactly.
I mean, the report mentioned that at the start of 2024, 2.8 million people in England were economically inactive due to long-term sickness.
It's a staggering statistic, isn't it? And
Yeah.
it's a stark reminder that neglecting healthcare has these ripple effects throughout society.
Totally, it's like a domino effect.
It is.
One thing leads to another.
Yeah.
But okay, let's say we do manage to get a handle on this funding issue.
Okay.
Is that enough? Is that enough to solve all the NHS's problems?
It would be a huge step in the right direction. There's no doubt about it. But I think the report is very clear that throwing money at the problem isn't a magic bullet.
Right.
We need a much more holistic approach, don't we?
Okay.
One that actually addresses some of the systemic issues at the very heart of the NHS.
Like what specifically? Give me an example.
Well, I think for starters, the report highlights this wide variation in performance across different parts of the NHS.
Okay.
You know, some areas are doing a fantastic job, while others are really struggling.
Ah, the old postcode lottery.
Exactly. And so the report kind of suggests that a key to addressing this inconsistency is about better collaboration and knowledge sharing.
Okay.
You know, identifying those pockets of excellence and figuring out how do we replicate those successes across the entire NHS.
So it's not about reinventing the wheel in every single location.
Precisely, because there's so much to be gained from learning from each other,
Yeah.
sharing best practices, you know, creating this culture of continuous improvement across the board.
Makes you wonder why that isn't happening more organically already.
Well, the report actually points to a culture of competition and siloed working within the NHS as a major obstacle.
Okay.
So you've got these different parts of the system that are often operating in isolation, which just hinders collaboration. It stifles innovation.
Do they need to be singing from the same hymn sheet?
Exactly. It's like they're all playing different tunes, and then they're wondering why the music doesn't sound quite right.
Right, yeah.
And so the report really advocates for a much more integrated collaborative approach,
Okay.
where different parts of the NHS are working together seamlessly to provide that truly patient-centered care.
So breaking down those silos, fostering trust,
Absolutely.
and remembering that they're all ultimately on the same team.
Exactly.
That sounds like a pretty tall order.
It is a significant cultural shift. There's no doubt about it.
Right.
But the report really stresses that it's absolutely essential if we're going to create a more efficient, effective, and sustainable NHS for the future.
And speaking of the future, there's one more crucial aspect we really need to touch upon before we... Okay, don't keep me hanging. What's this crucial aspect? What's going to make or break the future of the NHS?
Well, it's not just about, you know, structures and systems.
Okay.
It's about people.
Right.
This report really emphasizes the importance of staff engagement and patient voice.
That makes sense because you can have the most advanced technology
Yeah.
and the best laid plans, but without a motivated workforce
Right.
and engaged patients, it's not going to work.
It's not going to work, is it? And I think, you know, the report highlights how years of underfunding, increasing workloads, all of this has taken a real toll on NHS staff.
Yeah.
And there's a real need to address issues like burnout, morale, creating that supportive work environment.
Right, because a burned out doctor or nurse
Yeah.
isn't going to provide the best care.
Exactly. And it's unrealistic to expect them to, isn't it? It's like
Wow.
expecting, you know, a chef to create a masterpiece meal when they're exhausted and they haven't had a decent break in days.
Yeah.
It's just not going to happen.
It's not going to be good.
It's not going to be pretty.
Exactly.
And then on the patient side, the report also stresses the importance of shared decision-making, really listening to what patients need and want.
So we're talking about moving away from that old school paternalistic model of healthcare.
Yes.
And embracing a more collaborative, patient-centered approach.
Exactly. Empowering patients to be active participants in their own care, involving them in those decisions, respecting their preferences.
Yeah.
It's about seeing patients as partners, not just passive recipients of care.
Absolutely. And I think that really resonates with a lot of people these days. Yeah. Because people are all a lot more informed. They've got access to information at their fingertips.
Exactly.
So it makes sense that they're going to want to be more involved in those decisions.
Absolutely.
But how do we actually make that happen?
Right.
It's easy to say we need more patient involvement.
Yeah.
But putting it into practice feels like a whole other challenge.
It's a journey, isn't it?
Yeah.
And I think it requires a real shift in mindset from both healthcare professionals and patients.
Okay.
The report suggests things like promoting what we call health literacy.
Okay.
Providing clear and accessible information, and crucially creating opportunities for patients to share their experiences and feedback.
So basically giving people the knowledge and the tools to kind of advocate for themselves.
Yes.
And navigate this really complex system.
Exactly. Empowering them to have a voice and then crucially ensuring that that voice is heard.
Okay, so it's a two-way street.
It is, absolutely, because it's not just about speaking up, it's also about listening.
Okay.
The report really emphasizes the need for the NHS to be more responsive to patient feedback.
Right.
To learn from mistakes, to continuously improve that quality of care.
So a culture of continuous improvement.
Exactly. But it all comes back to that question of resources, doesn't it?
It always does.
It always does.
Because how can we realistically expect the NHS to make all these changes, invest in staff, empower patients, embrace technology when it's struggling to, keep the lights on?
It's the million-dollar question, and it's one that the report doesn't shy away from.
Right.
It acknowledges those significant financial challenges facing the NHS, and it calls for a long-term funding solution, something that provides that stability and predictability.
Right, because constantly being in this cycle of will we, won't we have enough money?
Exactly.
It's not helpful for anybody.
It's not helpful for staff morale. It's not helpful for patients.
Yeah.
It just makes it impossible to plan for the future, to invest in those innovations, to address those systemic issues that we've been talking about.
We need a long-term vision, a commitment to sustainable funding.
Absolutely.
And I think a collective recognition that a healthy nation requires a thriving NHS.
Couldn't be put it better myself.
Well, we've covered a lot of ground today.
We have. It's been quite a deep dive.
It has, from the state of the nation's health to the challenges of access and funding, the impact of the pandemic, the potential of technology.
It's a lot to take in.
It is a lot, but I have to say, even though this report paints a pretty stark picture of the challenges facing the NHS, I don't feel completely disheartened.
No, and you know what? What gives me hope is that this report isn't just a diagnosis, it's a call to action.
Right.
It lays out the problems, yes, but it also highlights those potential solutions, and it really emphasizes the need for collective action.
And that's where our listeners come in.
Exactly.
They've given you a glimpse into, the complexities of the NHS. But it's really up to each and every one of us to decide what kind of healthcare system we want for ourselves and for, future generations.
Absolutely. This isn't just about policymakers and healthcare professionals. This is about all of us.
Right.
We need to stay informed, engage in these conversations, hold our elected officials accountable. The future of the NHS really does depend on it.
So to our listeners, we say this: stay curious, stay engaged, and don't underestimate the power of your voice.
Well said.
The NHS belongs to all of us, and it's up to all of us to make sure it thrives.
Hear, hear.
Until next time, keep diving deep.